which our darling state comes into phase 2, stream 2, which will be starting next month. So that's where we are. So it's these are communicable diseases that are preventable, and we'll see how it affects everyone, including adults also, as we go further.
Okay, so from what you have said, rubella affects not just children, it also affects adults as well.
Yes, with special concern for us with pregnant women and their unborn babies.
Okay. So I'll come back to you, Kalu Ugonna. I know you're part of the technical working committee when it has to do with immunization in Imo State. Why is this particular MR vaccination campaign described as the largest immunization campaign in Africa? Why is it so important that people should, first of all, have it in their minds and get prepared when it comes down to Imo?
Okay, thank you, Diva, because I would say this is the biggest campaign in the whole of Africa, because if I would start from the time immemorial, Nigeria records 50% of the children going down with measles and rubella across Africa. So when you look at it, the age range of 9 to 14 years is a very big age range, and that is the children we are targeting for this campaign. Okay, as you said, it is the largest because this is the first time. Okay, measles has been on. We've been vaccinating the children under 5 with measles, but we are introducing rubella now. Okay, which is, we know that is a German measles. That one is a little bit more disastrous than the measles, because it affects both the elderly, the immunocompromised people, the pregnant people, pregnant women, not only the under 5 children. So basically, we are looking at covering a whole lot of birth cohort, which is 9 years to 14 years, which after the campaign will now revert back to the normal vaccination schedule, which is for 9 months and 15 months. So we are looking at the country is looking at prioritizing this and making sure that every eligible child is vaccinated with the MR vaccine, so that we can reduce the incidence of this particular disease.
Okay, so I heard you say German measles. I beg, which one is German measles again? We know of the normal measles. Children particularly would always come down with measles. So when you say German measles, is it different from the normal rash that we see, that children always suffer from? I want to know. It's quite confusing.
Yeah, it's a little bit different, like my colleague said. It is underreported.
Okay.
That is why we've not been able to, ascertain the level of incidence. But by the time we look at the data already on ground, we now say that the incidence is going higher. And that is why we are introducing the rubella to the measles vaccine. And remember, I said 9 months to 14 years.
9 months to 14 years
for the campaign.
We'll come back to the age bracket, because something is a little bit confusing. I know that at childbirth, vaccination is given up to 1 year, 2 years, and thereabouts. But 14 years, okay, don't worry, I'll come back. Dr. Uzo, rubella. It's another name we want to hear this year, 2026. It has been in existence for years. However, let me shock you that this is like the second time in my whole practice as a health journalist that I will hear of the word rubella. What is rubella measles, please? Let's explore, and dig deep into what it is so that people will understand this better.
Okay, thank you very much, Slim Diva. So the rubella is also known as German measles. Now, because the reason is because it has some similarities to measles. Now, in terms of the rash, what causes it, the virus that causes it is different from the measles virus. Now, the rubella, call it the German measles. Now, a lot of people would argue, because we say, it's milder in children than measles, is less deadlier, but even though it's more communicable. But now the problem why this campaign is pushing at it is you still see the typical rash that looks like measles, though milder. But the difference is that it's easily communicable. So it is more contagious than measles. Now, the idea, like the technical committee Oga has said, is that part of the problem is with the unborn child.
Okay.
Now, the pregnant woman contacts a child with rubella, like he said. Like we all know, it is underreported, so it looks like it's not common. But it is, because most of these infections, they are self-limiting. So most times, if you don't do anything and there's no complication, the child gets well and continues about their business. And most times, this child is already infectious, is infecting others close to 7 days before the rash appears. Unlike in measles, where it's maybe about 2 days before the rash appears and then 4 days after the rash appears. But for rubella, even up to a week after the rash appears, they are still infecting.
So they could be asymptomatic.
Yes, and
have
still
the
infect
symptoms,
others.
Infect others,
Yes,
and
but-
at that initial stage, you
Yes,
don't show.
but now where the problem comes now is the only thing you may see is that they may have a small swelling at the back of their ear. Now, but careful not to judge every swelling at the back of the ear. It's
As
called a
rubella.
lymph node as rubella. That's not the problem. Point is the rash. The point is the rash. No, it's a
What's the
lymph node.
difference?
Mumps is the salivary gland, just at the edge of the jaw.
Okay.
Rubella swelling is a lymph node. It's like a small bean-like thing at the back of the ear.
Exactly.
You have that as part of these symptoms that differentiates it when you see some of the rash from measles. Now, the problem we have with rubella is when a pregnant woman contacts this rash in the first 3 months of pregnancy.
Okay.
There's something that we'll discuss here that is congenital rubella syndrome, which is the reason, like when you asked, why are we immunizing children 9 months to 14 years? Children who are older than 9 years are getting into puberty, reproductive age. So you need to protect them. You need to protect them against these communicable diseases. Children who are about 9 months, if their mothers got immunization or got infected and the antibodies their mothers have given them is wearing out, so you need to start giving them theirs to start building for them.
Okay.
So the problem is with the unborn child, because if the mother gets a rash, gets rubella in the first 3 months of pregnancy, most of these babies die in the womb. Some come out blind, some are born deaf, some are born with holes in their hearts.
Oh my God.
So most of because even in recent times in practice, we've noticed that there is a high incidence of children coming down with holes in their heart who were born with it. And till date, we keep looking for causes and we cannot find causes. So that's where we are with rubella and why we are screaming from the top of our voices about rubella.
Okay, wow, this is now getting more interesting. So the target, I want to ask, maybe I'll ask Mr. Kalu, while immunizing the children, do you also immunize the pregnant women as well? I just want to know, because from what he has said, it's also possible that it can be transferred from mother to fetus. Am I right?
Yes.
So while immunizing the children 0 to 14, do you also have it in your roll-up program or rollout program to immunize the pregnant women so that they don't have the children do not have the, what did he call it now? Congenital rubella syndrome.
Yes.
Exactly.
So thank you for the question or for the response. Please, I would like to say for this campaign particularly, we don't have a target for the mothers for now. We are
okay.
targeting 9 months to 14 years.
Just the
now,
children.
when we get these children vaccinated, because they are the main reservoir of this virus, so when they come in contact with their mothers, they will not infect their mothers. So that's why we're trying to protect them, so that as we are protecting them, we are protecting the mothers and also the unborn children. So for this particular campaign, which is starting from February 4th, by the grace of God, we are targeting children of 9 months to 14 years, basically.
Basically,
Yes,
for now.
for now.
Maybe later in the long run, you now
Exactly.
target other age
Yes,
brackets.
exactly.
Okay, so rubella, yes, you said it's contagious, Dr. Uzo. how can people contract rubella? I know it's very important we should state it clearly, especially for pregnant women who may be vulnerable.
Okay, thank you very much, Slim Diva. So, rubella is gotten in two major ways. One of them is contact with someone who has the rash or who has rubella. And then the second is droplets, respiratory droplets. Now, what I mean by respiratory droplets, because some of them would come down with cough, catarrh. So when you make contact with some of those droplets from the respiratory tract, from their nostrils, it's easy to contract rubella. Yes, so that's basically how rubella is contacted in the community.
Okay. All right. It's a good time to open up the phone lines for people who just tuned in. If this is your first time of joining us, you are welcome and welcome back to the year 2026. Health Revolution is the program. My name, as always, is Mary Omeniwode. You can call me the Slim Diva. You're most adorable. I'm riding solo today, actually. Dr. Onwukwe Uzoma is here. He's a pediatrician, and Kalu Ugonna is also here. And we are talking about the importance of the MRV vaccination campaign, which will soon kick off in Imo State. It has already started off in the northern states, from what I can hear. The phase 2 will kick off from next month. So in line with that, we are also discussing and talking about the diseases that are being targeted. Rubella is number 1 on the list. Ever heard of rubella? You want to know more? You have questions to ask? Now is the time. 0911 20022, 0911 20022, or you call 0707 454 1014, 0707 454 1014. SMS line remains 0707 491 3438, 0707 491 3438. Now, you mentioned that rubella appears like a rash, right, on the child's body. I know that when a baby is growing up, or when a child is growing up, there are a lot of rashes or rash-like kind of, I don't know what to describe it, that comes up on their bodies. You hear some liken it to what we call nra. All these babies, I don't know, they will tell you it's something that affects children. It's a normal thing for children. So is it also possible that nra is a form of rubella? Dr. Ozo, I'm asking you, but let's take this call. Hello, good morning to you. Hello. Oh, sorry about that. Try as much as you can to redirect your calls. And we are live on Facebook at Echo FM 100.7. Go right now, like, share, drop your comments. We are also live on YouTube at Echo FM. So I was asking if nra is the same as rubella.
Okay, thank you very much, Slim Diva. It's a technical question. Now, our people have learned to call every rash in a child of a certain age nra. And the first thing I would say is, if your child has a rash, take your child to the hospital.
Okay.
Someone needs to see the rash.
Tell them.
Now, the idea is some of these rashes may be because this child has been covered extensively. Some of these, so there's a lot of heat, and then some of these rashes are because of the amount of oil that we rub on these children's body. Sometimes we want to recoat them, and forgetting that if you are feeling hot there as an adult, then that child is also feeling as hot as you are, wherever you are per time with that child. Now, yes, some of these rashes may be. Now, there are a lot of viruses that children are exposed to. And most of these viruses, which measles and rubella are part of them, part of their presentations are as rashes.
Okay.
But the rashes are distinct. They are different in the sense that they have a different timing for each of the rash. They have different timings. They have different presentations. Some will come with fever, some no fever.
Okay.
Some will first start with cough, catarrh, running nose. Some may just give diarrhea and then you see the rash. Those ones, sometimes we generally look at them and call them viral exanthems. So those are viral rashes. Because you need to ask certain questions. You need to ask certain questions so that you can differentiate which rash exactly this is. Now, sometimes in these children, because of those oils we use, because they are in damp, hot environments, their skin is soaked in sweat all day because of how thick they are dressed, they tend to get fungal infections. And these fungal infections are weeping. Like if you look at them, they are wet all the time. Sometimes they are shiny, they are scaly. Those are mostly fungal infections. And then sometimes you go ahead and hear people say, oh, they rub the triple whatever they rub. And then you get some relief because it's like mixing a lot of medications to kill one thing.
Okay.
It starts working, and then at some point, it's not enough to kill off what you started. So my point here is, Nra does not have an English name because it is not just one thing. The same way when people say Jedi Jedi, if you ask 10 different people, they'll tell you 10 different things.
Okay.
So the same way those two, once they don't have an English name, it's usually just, it's vague. So you need to see someone that will look at it and decide exactly what this is. Most times the problem is by the time we choose to go to see a doctor for it, we have done a lot of things. So we're now looking at a secondary rash and we don't even know what the primary thing is.
This is very important. You just reminded me of something. Especially our mothers, they are culprits. When they go for omugwo, they rub shea butter on this baby. They rub petroleum jelly. They rub what they call it, udaki, right? They rub everything rubbable. And then they still wear these babies thick clothing. How will they not come down with rash? And then at the end of the day, when rash appears on the body, you say it's Nra. Everything is Nra. You've heard Dr. Uzo now. It might not be Nra. It might be a fungi infection. I just thought I should also chip in that. All right, your call 0911 20022 0707 4541014. Keep your calls coming in. Let's hear what you have to say. Contribute, ask necessary questions. Okay, that is network. Try as much as you can to call me back. We are live on Facebook. And I have someone on WhatsApp. She has pleaded that I shouldn't mention her name. And she says, is it 9 months to 14 years or 9 years to 14 years? When you have to talk about the rollout vaccination. Mr. Kalu, please.
Okay, thank you, Diva. It is 9 months to 14 years for the campaign.
Okay.
9 months to 14 years for the campaign.
Okay.
Thank you.
So, but what about children that at some point in their lives took the measles? Is there anything, measles only vaccine?
Yeah.
Are they also eligible? We'll come to that. Let's see if this is going to connect. Hello? Okay, network is doing me dirty this morning. So are they still eligible to get this particular MR vaccine?
Yeah, the answer is yes. For the campaign, notwithstanding or not looking at the vaccination status of the children, they are all going to receive the vaccine as far as you are within the age bracket of 9 months to 14 years.
9 months.
Notwithstanding the vaccination status.
Okay.
Because we want to beef up the immunity of the children all round.
Okay.
So for Imo State, we are going to vaccinate all the children, whether you've been vaccinated with measles vaccine before or not. You are going to receive the MR vaccine come 4th of February till 10th of February.
Okay, like a 1 week rollout program
exactly.
for children. And I know that schools will be resuming from next week.
Yeah.
So I will be asking you the best locations. For instance, if the immunization officers do not get to schools, where can people now go to get those vaccines? I don't know if you understand what I'm asking. I'll be asking you that. But I want you to keep your calls coming in. 0911 20022 0707 454 1014. We are live on Facebook. I have got some messages on Facebook. Favorite Wisdom says, my name is Favor from Imo State and I like your program. Thank you so much, Wisdom, for tuning in and watching us live on Facebook. Witty J Zimara, greetings to you. Amiable Mary, you are doing well. Thank you so much, Zimara. I see you. And yes, we are also on YouTube at Echo FM 100.7. Okay, let's see if this is going to go through. Good morning to you.
Hello, good morning.
Hi, good morning. What's your name, please?
My name is Faith.
Oh, Faith, Happy New Year to you. Where are you calling from?
Okay, I'm calling from Oji.
Okay.
There's something I want to ask.
Go ahead.
Okay, like my boy, he's 4 years now. Most of the times, he's just a fake boy. He's fair in complexion, understand? So most of the times, he used to have some rashes. And that rashes would be like heat rashes. Sometimes it will be like pure red. And then the thing will just full on his body. Like the last one that happened to him, now we went to a nurse, so he gave us an antibiotic. I don't know, I have forgotten the name of the girl, but he used to mix with warm water.
Okay.
So after taking it, the thing just disappeared. I don't know the kind. Is it like or what? I don't know.
How often do does it appear on his body? How often? Is it all the time?
Not all the time. Once in a while.
Okay. Keep listening. Dr. Uzo will attend to that particular question. Thank you so much,
All right,
Faith.
all right.
Dr. Uzo, yao. Over to you.
Okay, thank you very much, Faith, for your comment. And the first thing I want to applaud is your concern for wanting to look after your child. The second thing I want to say is, like I said earlier, these rashes, your child is a fair child. So your child is the kind of a child that even if mosquito bites your child, it will appear red because your child is fair, like you said. Even if an insect bites your child, that area would appear red. Now, you talked about a rash. Now, the reason why I said, you should take your child to the hospital to see a doctor, most preferably if it's your child, a pediatrician, is that there are a few questions that he needs to ask you about the rash, about a few things around it. The answer to every fever, every rash, every cough, every catarrh, every sneeze, every tummy ache that a child has is not antibiotics. And that brings us to a raving war. That's not what we're discussing today, about antibiotics stewardship. And honestly, we are failing a lot, even as doctors. We are failing a lot on that part. And it is, I think it's not just a prayer thing, but we need to get to a point where we need to be stewards and understand that everything is not antibiotics. And we cannot go throwing antibiotics for things that just watching and waiting will allow to go. So what I'm saying is, I don't know what is on your baby's skin, because things that have to do with the skin need to be seen by somebody who knows what it is and who can ask you the right questions. So just going to anybody and they throw drugs around. Yes, I applaud that you have enough concern that you want your child to be immaculate, to look good at all times, which is great. But you can always go one step further and ensure that the outright right thing is done for your child.
Okay. Now, you talked about antibiotic stewardship. I know it's not part of what we are discussing, but I know we would always, last year, in fact, before 25th December, I had to take up a campaign, antimicrobial resistance. It's a problem, big problem. You heard her say she took the baby to a nurse, and then the nurse gave the baby antibiotics. And that's what we see. Apart from the nurse, over the counter, once you go, you present with any symptom, the first thing that they give you is antibiotics without, first of all, carrying out the necessary test and all that. Well, that's, by the way, 0911 20022 0707 454 1014. Send us a text message or WhatsApp message on 0707 491 3438. So for adults, I want to find out again, is it the same symptoms? I mean, the rubella virus now. Is it the same symptoms with that of children? I mean, for adults. Dr. Uzo.
Okay, yes, the symptoms are the same. Rubella is rubella for everybody. So generally, there's things we call non-specific symptoms. You feel sick, you feel listless, like you feel heavy in the head, headaches, maybe low-grade fever. So the thing will say, okay? Sometimes you might have red eyes, red eyes, there's cough, there's catarrh. Like I said, some of those lymph nodes are swollen. You see these things on flyers. So some adults will come down with sore throats, and then the other things, general discomfort, and then the rash will now appear. So generally, in adults, in children, it may just be mild, that the child just has fever, the redness of the eyes, just the child becomes fuzzy. But for an adult, you notice low-grade fever, sore throat, you have headaches, running nose, and then you just feel a bit fuzzy. You just feel there's a state of unwellness, but you can't really point out what exactly it is. And then following this, the pink eyes, then after just a few, maybe about between 5 to 7 days after this, the rash appears. Now, like I said, the rashes have a common, they have a different way they show up. Unlike for measles, where most times it starts at the back of the ear, then comes to the face, and then spreads down to the body. And the way it comes is the way it goes. Rubella most times will start somewhere around the trunk, and then the limbs before the face, if any, or sometimes the face and then the trunk. So it depends on the child, so which is why, like I said, so part of what I said for adults is, like the pregnant women, why we're emphasizing this is it's very contagious. So a child can pass it on to a pregnant adult. Of course, it's not a child that is pregnant, it's usually an adult. So you pass it on to a pregnant adult, and then we're back to what we discussed earlier, the CRS, congenital rubella syndrome, which now affects the child, which it's a common cause of blindness in children, deafness in children, stillbirths. That's the child dies immediately the child is born, and then congenital heart diseases, which we regularly or colloquially will say holes in the heart.
Okay. And then measles, another important disease that is being targeted by the MR vaccination campaign. Let's talk a little bit about measles. I know most people see that as a common thing, it's a normal thing that happens to children. Why are they even talking about it? It doesn't concern me. It concerns everybody, because when measles shows up, we do the wrong things. Am I right, Dr. Uzo? So help us, a little explanation on measles.
Okay, so like I said, measles is it's more of it's a viral infection caused by the measles virus, and it's a vaccine preventable disease like rubella and a few others. Now, measles usually would appear. An individual can get the measles virus and still have it within your body, and it incubates for about 10 days. And then we'll have these symptoms I talked about earlier within 2 to 4 days before the rash would appear. Now, remember that within all this time, up to 4 days after the rash appears, this person or this child can transfer the virus. Now, beautiful thing about it is that if you've had measles before, it confers lifelong immunity.
Is that actually true?
Yes, that is true.
Okay.
If you've had measles before, it confers lifelong immunity. Now, what happens with measles is, with the rash, and that the problem with measles is it's self-limiting. So if you take care of all the symptoms symptomatically, patient gets better. But the problem with measles is it's a virus that keeps giving even after years have passed. Up to 10 years, you can still come down with complications of the measles that an individual had 10 years ago. Now, what usually would kill children who have measles, usually the complications. Most of them will come down with diarrhea. Most of them will come down with pneumonias. Some can come down with even meningitis. That's infections of the brain and the coverings of the brain. And those complications are where we are worried. Now, some can even have like some form of brain shrinking. I'm trying to just I don't want to use big words. By 10 years, between 2 to 10 years after having measles. So the campaign is just beyond, and then because of You know how crunching the economy is now. Children who are malnourished are at very, very high risk of contacting these viral infections, which is why the vaccines that are being rolled in this phase and this stream are very important to all of us as healthcare workers, because we also come in contact with these people and these children. And if we vaccinate as many people as possible, then we have a healthy community. The idea is to have a healthy community. A healthy community would prevent outbreaks like we had during the COVID and even recently the diphtheria because of poor vaccination. Yes, so this vaccination, because the idea, like the technical committee, Mr. Carlo would even know a lot better than me, is that if you vaccinate at least 95% of your population, you can protect, you can gain what we call herd immunity. And herd immunity is like community protection. So measles, it's a lot about the complications, because that is what kills. Measles itself is self-limiting because it's viral. But it can come down with complications like pneumonia, which is one of the, and diarrheas, which are the commonest causes of deaths in children under 5 years. Hence, our screaming from the rooftop about the MRV vaccination and vaccination in general for children.
So since it is self-limiting, like you said, that means it can fade out on its own after some days, right? That's what you're saying?
Yes, the virus and the infection, not the problems it causes. So you have to deal with the fever. Okay. You have to deal with the discomfort. You need to deal with the dehydration from the fever. So in terms of the virus, it's not like someone is having fever. You are sick, you don't feel good, to just lie the person down and watch and wait for it to self-limit. No. There is, what we have is symptomatic management. So we can't tell you that, oh, there is this drug that will kill the virus. What most medications, most antivirals that are available, what they do is most times to reduce the burden of the disease and to shorten the time, possibly the time of the infective period for certain viruses, but not measles.
Okay. Mr. Kalu, I'll bounce back to you. The phone lines are still open: 0911 20022, 0707 454 1014. For people in underserved areas, the rural communities, I hope you're also targeting such people in your upcoming vaccination program, because I know that growing up, you would always see these people wearing is it green? I don't know what to call that vest, that greenish vest, they would always wear and go around. But the truth is, in recent times, I hardly see those vaccination officers on the streets. I actually don't know why it is so, but what's your plan for people in the rural areas and underserved areas as well?
Thank you, Diva. That is a very unique point.
Sorry to cut you. Let's see if this is going to go through. Hello? All right, and it's off again. Go ahead, please.
Okay, for Imo State Primary Health and the stakeholders, we've planned that every part of Imo State will be part of the vaccination. For the vaccination proper, all the primary health centers will be open. All the primary health centers. All.
We have to re-emphasize. All. Okay.
As far as they are offering routine immunization, all of them will be open for that period of vaccination.